So thus far we've talked about task or work groups, and in doing so we unpacked the 5 C's of task or group work, all of which are extremely important irrespective of the type of group work that you're doing. So please, as we move forward to psychoeducational groups, I'd like to encourage you to keep the 5 C's in mind because they are extremely important irrespective of the kind of group work that you're doing. So as we talk about psychoeducational groups, I want to emphasize that first and foremost within this term, psychoeducational is the term education. So what we're doing in psychoeducational group is bringing to the awareness of the group members a certain knowledge base. We want to make sure that there is a knowledge, an understanding, and an awareness of certain information that is of key importance. And through the informational awareness, you're also wanting to impact their psyche, impacting their emotional state, their coping, adjusting, and ways of making sense and understanding the phenomenon that's of key importance. So there's an educational part as well as a psychological part, both of which is involved in psychoeducational groups. So as we move forward in talking about our discussion about psychoeducational groups, I want you to keep in mind exactly what psychoeducational entails. There's a knowledge-based component where there's an education of relevant information about a phenomenon, and you're incorporating the mental health, the psychological aspect. So through this education, you're positively impacting one's mental state or well-being. So when we speak of psychoeducational groups, we're looking at several patients or clients, however you choose to identify them, that are informed about their illness at once. So let's think about schizophrenia, for example. You might have a group of patients, all of which might have schizophrenia, and in the group context, you're informing or educating all of them about their mental illness. The one thing I will say about schizophrenia, since I used that as a particular example, is that, schizophrenia can be quite different from other kinds of mental illness or illness in general. So perhaps schizophrenia was not the best example to use. But let's say if it's issues related to bereavement or death, the death of a loved one, we know that all the persons that are there, they're there because there is this shared experience associated with the phenomenon. So whether it be an illness or bereavement, we recognize that they're all there for this shared experience. And we want to also inform them of whatever the condition is or whatever the state is. So we are giving them information so that there is a greater awareness or knowledge base. And we're also wanting to ensure that in the process of sharing the information with persons who are all experiencing the same phenomenon, that there is support that is provided by all of the individuals, not only by the therapist, but the shared and mutual support of other members in the group. And through this shared experience of support and of through information, as well as that the cohesiveness and shared experience, there is healing that exists within that process. So with psychoeducational groups, education is offered to people who live with a psychological disturbance. It includes patients as well as family members. It's frequent psychoeducational training for patients with either schizophrenia, clinical depression, anxiety disorders, psychotic illnesses, eating disorders, and personality disorders. And so these are some of the psychoeducational training groups that are most often recognized and that are in existence. So with schizophrenia, we know that there are different kinds of schizophrenia. And so that's why it might be a little bit difficult, because persons can have different kinds of schizophrenia, different side effects associated with it. However, some of the generalities associated with the disease, or any disease, is what you would want to focus on. Some of the things that are overarching that might be consistent for all individuals. And then you would want to talk about the ways in which the disease manifests and some of the age-related issues and gender-related differences. You would want to talk about the medications, some of the kinds of medications. What are some of the side effects? What are the positive outcomes associated with the medications? What are the implications of stopping the medication? And so it's an opportunity where multiple individuals with similar kinds of psychological issues come together, and they're informed through education, and they get the mutual support, encouragement, and emotional growth through that experience, not just from the leader or facilitator, but from each other. Because one of the things we've talked about, and it's particularly relevant as Yalom communicates, is that what's beneficial in group is that shared experience, knowing that individuals are not alone, that there are others who have experienced something very similar. So we talked about the norming that exists within the process. And so that's also relevant for the psychoeducational groups, where people can recognize that, you know what, I am not going through this issue by myself. There are other individuals that have similar kinds of issues. And so through that process, they learn from each other. They learn effective coping. They learn strategies. And so that feeling of not being alone and not being isolated is in and of itself a normalizing experience that proves very beneficial to a person with a psychological issue. So with psychoeducational groups, the primary goals are to help patients or clients to understand and cope better with the presenting illness. So whatever the problem is, it's to expand their knowledge base. And whenever you expand a person's knowledge, they're better able to cope with whatever it is they're going through. You want to reinforce a patient's strength. You know, within every individual is the strength and the resources and the coping skills to overcome or make it through whatever they're going through. So you want to reinforce a patient's strength, resources, and coping skills. And you also want to assist them in avoiding relapse, avoiding reversing some of the positive things that have taken place. And group therapy, particularly through psychoeducational groups, it's an excellent way to assist people in avoiding relapse. It contributes to patients' own health and wellness on a long-term basis. So not just in the moment, but long-term, it helps them to realize that this issue is not unique to them. Others with similar kinds of issues have to do the exact same thing if they want to be free of the illness. And usually treatment is a part of it, whether it be a psychotropic kind of treatment or psychotherapeutic treatment. But the person understands that they too must play an active role in their health and well-being in order to have long-term positive benefits associated with the illness. With psychoeducational groups, the better knowledge that an individual or patient or client has of their illness, the better the patient can live with their condition. So when they're able to understand what is happening, what has happened, so they know that, no, I'm not going crazy. This is real. This is what has happened is legitimate. So they can also anticipate. So when something happens in the future, they're in a mode of anticipating, and they're not as shaken because they know that what has occurred is to be expected. It's also destigmatizing the psychological disturbance. So it's knowing that, hey, it's not abnormal. What you're going through is normal in light of the identified illness that exists. And it's also consistent for other individuals. It diminishes the barriers to treatment. And I find particularly with persons with schizophrenia, when they understand what their mental illness is, how it affects them, the different kinds of treatment that exist, the importance of being an informed participant in their treatment process, and how they must also maintain involvement in treatment, it minimizes the extent to which they will stop participating in their treatment. It broadens the person's view of their illness and how they see themselves, how they feel about themselves, and it increases a patient's understanding so that they can positively impact their well-being. So in increasing a patient's understanding, it can positively impact the individual's well-being, how they see themselves, their ability to participate in treatment, and just their overall commitment to overcoming the obstacles. They feel a greater sense of control over their circumstances. So psychoeducational groups are extremely important, particularly for persons with mental illness, various forms of mental illness, because it impacts them on a multitude of levels that allows them not just to focus on the here and now, but on their future, on the importance of the treatment and participating in treatment. I say to some of the clients that I work with schizophrenia, it's not that medication doesn't work, it's finding the best medication for you. And the only way your psychiatrist can find the best medication for you is if you're actively involved in the treatment process. So through informing the doctor what's working, what's not working, the best times of the day to take the medication. So if you find that by taking your medication in the morning leaves you lethargic and unable to function, then through a psychoeducational group, you empower your clients to have conversations with their primary physician or primary psychiatrist to know that morning isn't the best time. It might be better to give the medication at night so that it doesn't negatively impact their daily functioning. So there is power in education, and knowledge is power. And it not only changes what you know, but it changes how you feel and thus how you behave. It goes back to that cognitive behavioral way of thinking. It changes how you think, how you feel, as well as how you behave. So psychoeducational groups are extremely important. So in terms of the framework that exists for psychoeducational groups, there is information transfer. So there's the transfer of information as it relates to symptomatology. What are the symptoms? How does it impact your functioning? How does it impact your ability to navigate your environment, to get along with your family, your friends, your coworkers? What are some of the causes? It helps you to recognize whether there's a genetic connection associated with it. Sometimes with certain kinds of mental illnesses, particularly schizophrenia and bipolar disorder, oftentimes there is a genetic component associated with it. So helping people to understand the genetic causes that might exist, or whatever the causes might be, different kinds of treatments that are most effective. Maybe their doctor is giving them one particular kind of medication, but through the group process and through people talking and learning from each other, as well as learning from the group leader. They might recognize that there are other kinds of treatments that might be most effective. It might mean that their dosage is too high, so they might have to renegotiate or rediscuss these kinds of issues with their primary treating physician. So one of the key components, as we've discussed early on in this lecture, is that there is the transfer of information. There's also the emotional discharge. We talked about the fact that knowledge is power. And one of the powers associated with having that knowledge is that there's an emotional discharge. So people are not, the ways in which they see themselves or value themselves is enhanced because there's an understanding that promotes and encourages greater self-awareness, self-acceptance, self-love, and appreciation. So there's also that exchange of experiences with others that are involved in the process. So whether it be the exchange of information with the facilitator or other members, people learn a lot from other individuals who are going through the same experiences. So there's also an exchange of information from others who has a similar experience. They might share information regarding other kinds of medications, other kinds of treatments, doctors that might be more efficacious than the ones that they're currently seeing. So that exchange of experiences and knowledge is very key and pivotal to the ways in which persons are impacted psychologically. And the resources that they become aware of. People in group settings are often able to share other kinds of contacts and resources that exist within the community that persons may not be aware of. Even the facilitator may not be aware of. I could think of many experiences in a group context where members of the group could share knowledge that I may not have been aware of. They might know of job leads that exist. They're able to say to others, I'm currently working on my job and we're getting ready to hire five people. Here's the contact person. I have a mental illness. I'm working there. I'm doing well. I think that my supervisor is very receptive to having you there. I suggest you give them a call. I'll put in a word for you. So there's a lot of information that's exchanged. As such, there's an emotional discharge that occurs as well. As I mentioned, there's a support of medication and psychotherapeutic kinds of treatment that enhances the likelihood of compliance and adherence, both of which are extremely important in treating certain kinds of illnesses. We know that with schizophrenia, it's really important that the person is compliant with medication. And so group therapy, psychoeducational group therapy, is one of the ways of enhancing the extent to which people will become compliant and adhere to the medication that has been prescribed and their therapeutic involvement. We also know that it's the same for clinical depression, the importance of medication, as well as other kinds of anxiety or psychotic kinds of illness, eating disorders, personality disorders. It helps people to understand the significance of their treatment and their active engagement and participation in their treatment regimen. Assistance to self-help. Through psychoeducational group work, you empower individuals to help themselves. So the assistance to self-help is very important, ensuring that they have the training, the skills, the knowledge. As crisis situations are promptly recognized and also steps can then be taken to help the individual to help themselves, to identify resources, to enhance their well-being through information that they've learned. So these are 4 key underpinnings or foundational issues of psychoeducational group work that is extremely important. Informational transfer, education, emotional discharge, support of medication and psychotropic treatment, psychotherapeutic treatment, and assistance to self-help. all of which are extremely important and essential ingredients for psychoeducational group work. So here are a few characteristics of effective psychoeducational groups. So there might be education groups, skills training groups, so effective problem solving skills or anger management skills. These are also different kinds of groups. So not only is it educational, but it gives skills, it builds skills, so it helps the individual to expand their repertoire of skills that can be used in certain situations. Self-understanding and self-knowledge, self-awareness groups. Those are also characteristics of effective psychoeducational groups. So not only is there education, there's skills training and development, and also self-understanding and self-knowledge is also extremely important in helping to expand the extent to which the individual that is coming to the group can become self-actualized. So there are learning principles of psychoeducational group that are extremely important. And so I would like to share with you 8 of the learning principles. And so I'd like to start off with the first 4. And so number 1 says, develop goals and objectives that are specific, realistic, clearly articulated, and appropriately challenging. And so with ensuring that learning principles of psychoeducational groups are in place, you want there to be goals and objectives that are specific, realistic, clearly articulated, and appropriately challenging. You want to consider the developmental level of your group members. You don't want to have the group members trying to accomplish goals that are not within their developmental skill set, because that could be very demoralizing, demeaning, and depressing. So you want to make sure that whatever your psychoeducational goals and objectives are, they are consistent with the developmental level of the group members to whom you're working with. You want to make sure that you incorporate culturally meaningful learning activities. So you want to make sure that you cater to the diversity that exists within your group. So whether it's culture diversity, whether it's diversity of gender, sexual orientation, you definitely want to incorporate information in your learning activities that appeals to all of your group members. And you want to vary your instruction methods to accommodate the different learning styles. And so we talked about that a little bit before with task or work groups. You want to ensure that not only is it there's information that's exchanged orally, you want to have practical kinds of learned experiences. So learning through doing, role plays, or information exchanges through doing, interviewing, and role playing, and problem solving, talking through different kinds of scenarios. And you also want to put information in writing. Sometimes in writing or visually you might have, sometimes people use cartoons to communicate certain kinds of informations. Or it might be a drawing that might symbolize something that you're trying to convey and get across. So it's really important that you consider the different learning styles of the persons that are there, and you want to vary the information or the instruction to ensure that you accommodate for the different learning styles. You want to incorporate active or discovery teaching methods. Homework is very important. Making lists of pros and cons, maybe writing letters to different people that are significant, writing lists of goals and maybe your goals and objectives for the next 6 months or next year. And so you want to incorporate active and or discovery kinds of teaching methods that forces the person to not just think about the here and now, but long term. What are you working towards? What are your goals and ambitions? And you want to tie the content to relevant examples or stories. And this has to do with the sharing. There are times when, as a leader, a group leader, a group therapist, that you might have examples or stories to share with your group members. And sometimes they might be personal, and sometimes it might be of other clients you've worked with, but you want to make sure that it's relevant to the persons that you're sharing it with, and that there's a particular value that you anticipate that they will get out of hearing this information. Additionally, you want to give opportunities for feedback. You want to be willing to adapt to the members' learning needs. So feedback is really important, helping people to understand ways of forging ahead, continued growth and development. So not only are groups focused on all persons that are in attendance of the group, but you also want to make sure that you're paying attention to the unique needs of individual members as well. And that's one of the reasons why you want to incorporate different kinds of strategies and learning styles that take into consideration the individualized ways in which we learn and experience our environment. So as we explore different kinds of psychoeducational groups, we know that there are 6 steps that are really important in the planning and implementing process. They're not different from what we've discussed previously, but I definitely would like to revisit some of the planning and implementing steps or stages that are most important in psychoeducational groups. And the first step is your statement of purpose. What's the purpose of the group? What do you hope to accomplish? And that kind of ties into the learning principles of psychoeducational groups, especially number 1, where it says develop the goals and objectives that are specific, realistic, clearly articulated, and appropriately challenging, particularly as it relates to the developmental level of the group members. So the statement of purpose, what's the purpose of your group? What are the goals of the group, and what are the objectives? What do you want to achieve? And what's the content that will allow you to achieve your goals? So if you have an 8-week goal, 8-week group, you have to, for each of the weeks of your group, you have to parcel out exactly what are the goals of the group, what will you achieve in each of the group meetings, so that by the time you achieve the ending of your group, you would have obtained the desired goals and objectives that have been outlined. So step 1, what's the purpose of the group? What are the goals? What are the objectives? How do you get to the desired goals? What content will you use? So it involves doing a literature search, finding information that exists that will help you to achieve your desired outcome. Designing activities that are appropriate to help the clients move through the various stages of the group. And number 6, evaluating the effectiveness of the group process. And what we've talked about already in an earlier lecture is the fact that there are various ways of evaluating the effectiveness of a group. There's the summative process, and there is the formative process. We've talked about the fact that the formative process allows you to evaluate the effectiveness and make adjustments as you're moving through each of the stages. You're evaluating and assessing what you're doing, how it's working, and making tweaks and fine-tunes to enhance the quality of the groups. And then at the end of the group, you do the summative. You look back and you look at your group and its effectiveness, and you determine whether the goals of the group was achieved, whether your objectives were effective in meeting the outcome, and you might make changes for subsequent groups. I think it's important to use both summative and formative evaluative processes, because if you only use summative, that means that the group process is over, and so you've missed an opportunity to make the tweaks and adjustments to positively impact the outcome of the group. So formative and summative evaluative processes are extremely important. And you definitely, with any group, irrespective of whether it's a task, psychoeducational, or psychotherapy group, you want to begin with identifying what is the purpose that you're trying to accomplish here. What's the purpose of the group? What are the goals for meeting or reaching or attaining the purpose? And what are the objectives? So what are the steps one must take in order to meet the desired goals in the number of sessions that are available? And what's the content you will use in each of the sessions in order to reach the goals and objectives? And paying attention to the learning styles, you want to make sure that there are activities that are designed within the group, within the different stages, that pays attention to the various learning styles of the participants, of the group members, and you are in a mode of evaluating the effectiveness of a group through the formative process as well as the summative process. So if you're mindful of all of these steps as you begin to contemplate your group, plan your group, and work through the different steps and stages, you are sure to have an effective group whereby the members will meet the goals and objectives that were appropriate in helping them to positively impact their well-being, not only in the moment, but long-term. On a long-term basis, you would have impacted that individual's overall health and well-being. So that concludes this portion of the lecture as it relates to psychoeducational group. I hope you found this information helpful, and I look forward to sharing with you information that is relevant to psychotherapy group, which will be the next lecture. So thank you for your attention, and I look forward to sharing additional information in the subsequent lecture.